What causes stress incontinence, which is a leak, involuntary leak when you're doing some form of exercises or coughing, sneezing? It's, as I described, it's the weakness in the neck of the bladder area, which is either inside the bladder, which is called sphincter, or just at the level of the vagina where the tube, which is draining water, comes out. The risk factors include number of vaginal deliveries, especially if the instrumental delivery like forceps, there are quite a bit of trauma to pelvic floor. Then obesity, because it weakens your pelvic floor, and unfortunately, as we all get older, our tissues are not that strong, and there is a lot of laxity. Then other traumatic factor, which unfortunately a woman's body goes through, is menopause. And menopause causes lack of estrogen, and lack of hormones means the tissues are not that supple and they're not that strong. And I think the menopause and effect on incontinence and the vaginal health is highly underreported. And this causes a lot of issues, incontinence as well as discomfort. If you have smoking, you will always have poor tissues. And even if you want to have an operations in future, then the success rate reduces if you constantly smoke. And again, if you've got a bad chest and chronically cough, then it will weaken the pelvic floor. Other things also, which is not there in this slide, but if you have a tendency towards constipation, please treat them. The constipation can be a worst enemy. And if you are chronically straining, you're going to keep traumatizing your pelvic floor. And some neurological disorders where the bladder, if you got a little fistula, which is a tract between bladder and the vagina, if there's a through and through tract, or other neurological disorder which causes problem with sphincters, which is what controls in the continence, then neurological issues can cause both overactive bladder as well as stress incontinence.